Hi guys, so I wanted to go back over the wardrobe. So yeah, just to be honest, the washing needs to come in. There's not a lot in the knickers and the socks area, but yeah, just to cover it off a little bit better because I was so tired on my last video. So just to be clear, I mostly use the pocket runner all the way down. I've got my slippers and some of my nicer shoes that I might use. And to the left here, so there's this hanger here has, and again there's not much there, but that's my pajama area. And then I've got my favourite blacks. I wear a lot of black at the moment, so that's, if you remember the stacker, it all goes down. So there's 1, 2, 3 there at the moment, and some of the longer ones you can just hang up. The other really useful things are over here. You've got this little hook for scarves if you're a scarf person, and this hook is a lifesaver. You can put your belts and things on it, but what I've actually got is my dressing gown. It's actually hubby's, but I've taken it over. So yeah, you don't have to have the belt there, but this is really good for like say dressing gowns with a hook, or a jacket that you've been wearing that you might want to put on straight away every day. I've got a couple of jackets that I'll use with open arms, and you know, that are really wide. That you can use there. Up the top here, this is the wrist guard I was using around my wrist before the re-operation to get the pins out. It's been a little bit worn now, and I like to keep my bands from the hospital, so these are my latest ones. I've got a couple from when the girls were born as well, so that'll just be into my little collection. And then down the bottom here, you've got all your spare hangers that I was mentioning. What I didn't say was you don't want to have them in a big pile. They don't have to be super neat, but make sure you don't have them all knotted up. So you can just grab one out and hook it up the top somewhere ready to use. Again, you can put it on the doorway if you need to, but that technique of laying your clothes on the bed and then hooking this in is the best way of doing it. So over on this angle, we've just got another stack of clothes. So I've actually lined up a few large sleeved tops that I can put on easily. That's my pants rail. So the pants actually go, if I bring that one out a bit, you're just kind of whacking it over. So this works really well at night. So say I'll take this pant off. These ones are a bit clunky, there we go. So you got those pants there and you've just removed them. You just find the rail that you want to get it onto, so it'll be this one. And we're just gonna kind of hold the top loose so the pants go down, and just fold it over the area. So it just takes a bit of wiggling, shuffling. Okay, so then you've got all your pants on that area. I'm just doing that with one hand. And yeah, that's basically it for that. You can have another one of those at the back there for some of your tops, some coloured tops for me. Right, so that's all for there. And then I'll just take you back around the room. I've done this bit of artwork to look over my bed, so you've got something to look at. And just wanted to show you this device. Can you shut the door, please? This device, this is my laser device, and it is a clinical device, so it's not something you're probably going to have at home. But to do with wound care, you will need a lot of sleep. You'll need to be getting a lot of sleep. And if you think of it as in your body has stresses that happen every day, and the wound repair, the surgery is a large stress on your system, and you're going to need to actually rest the limb. I like to keep my area nice and warm, so I've got it currently wrapped up in my scarf here. I do have a lot of movement. That's something again you may not have because I've only had the plates removed from the area. There's been no nerves that have been I guess damaged or need repairing at the moment, so they're all working quite fine. so I can kind of hold the phone with one hand, but not a lot of weight bearing at this stage. You're letting that wound repair. So this is a low level laser, and I use this at the moment pretty much every day. But the idea with getting the arm to rest, I call it putting the arm to sleep, and I'll find a nice soft pillow. I'll just put it over here, and I'll actually lay my hand down, and you can just start to stroke your hand, rub over the areas that are sore, that sort of thing, just to actually allow your arm to fully relax. Try and get into a really comfortable position where you're not holding your arm, and just allow your arm to go to sleep. I call it just putting the arm to bed. I used to say a lot after my first surgery. There was a lot of pain, there was a lot of swelling. Sometimes I didn't know whether I could put it in the sling or put it above my head. Nothing just seemed to be helping at times other than the painkillers. And I didn't want to always go down that road. So I was just having a lot of bed rest, putting my arm up. And the laser was really good. So I guess along the lines of the laser, there are things like acupuncture or maybe some other physical therapies that you use that could be helpful right now for you to get into about a week after surgery, to have a look at something like that. Okay, so I'll just shuffle a few things around. So yeah, just making sure you're getting enough rest over the wound area. So that's really about putting the right nutrition in as well. So the right nutrition might be some good soups and some soft foods, nothing too raw, nothing too cold. You're going to be putting a lot of warm things in. The only thing I got other than my prescriptions on the prescription sheet leaving the hospital was vitamin C tablets. So they recommended that for the nerve repair at the time. So yeah, perhaps something like that. And I'm not a nutritionalist. I'm not going to suggest a whole bunch of things. The only other thing I do say to most of my clients as an obvious thing is some Inner Health Plus before and after your surgery, just to keep the gut bacteria strong and to rebuild that after all the medications that you have had pumped through your system. So movement is really good. So whatever movement you can do. Sorry, I'm gonna pull out. Sorry about this. I'm gonna pull out my arm so you can see what's going on with my fingers. Maybe that's harder than I thought. Sorry about this, guys. Maybe I can just peek it out the side a little bit. It's not really happening. Let's see. I think I'll just give you the general gist. So I've managed to get it a little bit unwrapped. Anyway, that was a bit sore, me yanking away there. So yeah, whatever movement you do have. Sorry, you probably can't see this terribly well. Good to get one of my yelling children in. Now here we go to help out. But all right, managed to get it out. So with your hand, so again, say you're getting your hand to really rest on the pillow, so you're finding the spot that really allows all the fingers to let go, the elbow to let go, your wrist to let go, and you might stroke your hand to get it to rest. Somewhere about now, you may feel a little bit of warmth going through the arm, you may feel a bit of blood flow going on, and just gently you're going to move your fingers. And just to see how much movement you have there, apply a little bit of pressure into the fingers, pushing down. Okay, so just try and do that really slowly, and also lifting up. So these sort of movements will be part of your exercises, to lift the fingers up and to push them down. Okay, they're part of our strength that happens through the fingers. Yeah, I mean, I got to about day 4 this time, and I noticed a lot of effects from the anesthetic that was put through just this kind of tiredness, this fatigue that would set in after maybe a couple of hours or so of being up and about with everyone. Walking outside, just see how you go with that, but definitely the first 3 days are a bit of a knockout. Just stay indoors as much as possible. It's really going to depend on you, but for me, taking the dog out on, was it day 3 or 4, I just felt everything was very active, and it's quite bright outside, and yeah, there's a lot of movement, there's a lot going on other than, our own body trying to heal itself. So yeah, just take things slowly, just go for a short walk to begin with, just see how you handle it. I probably tried doing a bit too much with the kids and the dog and that sort of thing, particularly on that day, and just felt a little bit dizzy and disorientated, even a little bit out of sorts. So this is just the medication, guys, that we go through in surgery, and that working its way out of our bodies, so don't be too alarmed by that. Things will move along slowly initially, and just keeping enough rest and water going through your body is really important. So the wound itself, like as the wound is repairing, you might get sort of these wound sensations. Like I particularly, again, I'm really bundled up, I'm particularly feeling it through this inner part, so that's obviously where they really went in quite deep, and a little bit on the back too. I've got 2 incisions, one on the front of my wrist of the palm and one on the back, and yeah, these can take on different feelings. There can be burning, there can be like this feeling of pooling fluid or blood flow, like a very strong ache, or that swelling again coming up through the fingers. You'll physically see your fingers just swell like 2-3 times bigger perhaps than normal, which is quite alarming actually. And elevation and doing all of those things are great. Sometimes it's just better just to go to sleep. Our body's had enough. There's a lot going on throughout the day. There's a lot for us to manage mentally and physically on a daily basis, let alone wound repair. So the sleep is fantastic. Get as much as you can, and yeah, take a little bit of painkiller before you rest as well if need be. Yeah, the best advice is to move the limb. So you're doing as much as you can. Obviously you'll have all your stretches there, but yeah, push yourself a little bit. When you feel good and the limb's not hurting terribly much, you can just start to move it in circles. You can start to do, your grabs and things. It may not be this much, so I can just feel that little bit of pull when I go down there, but yeah, it might only just be about that much, say. So you're just getting that movement back. That's still something, guys. Even the thumb, I do so much with my thumb, as a lot of us do, and that was super important for me. So just focus on the ones that are the stiffest as well, and just give those a little bit extra. Mine were the pointer. I think this, that guy wasn't too bad, but yeah, this one, the nerve must have got clipped a little bit on him. And yeah, my thumb wasn't doing a lot. So look, all that's come back, and not a lot of it's been affected this time around, obviously. They've just removed plates. Gravity. So when you've had your arm in a sling position, or you've had it elevated for days, maybe a week or 2, the effects of gravity are intense, guys. So I'm not going to be able to show you with the camera this way, but going from that kind of held position, and then you're going to want to slowly bring your hand down past your waist area. So that's where it's been held for so long, where you've had your arm up and you're going to start to bring it down, and that kind of moving and swinging. Now, I did a mistake by one weekend. I just started to adjust to the gravity, and I had my arm right down, back in the line where it would be if you're walking, basically. So that feels so strange, honestly, because it's just like all this blood goes into your fingers suddenly, you know, like gravity shifts. But I did a mistake of almost walking normally through the house and forgetting that I had a sore hand. So as I walked through the door, I've grabbed the door with my affected hand here, and that hurt a lot. So when you are walking around with your arm on the side, if it's an area where you know you're a lot, like you're in the bathroom, say, or you're in the kitchen and you know that area really well, and your hand's going to want to do stuff. I mean, this is just normal, right? Even if it's not able to, it's still going to reach out to try and help, which is a great sign. Just tuck your arm away, like put it across your chest or put it in your pocket, you know, that kind of thing, because you don't want to go knocking it when it's like this, particularly, which is what I did. And yeah, listen to your body. I mean, the stuff we can do with one hand, use your knees, your elbows, your chin, your teeth if you have to. Guys, I'm going to be real about this. You will have to use your teeth a little bit, and just ask other people. I was just noticing this morning it was hard to get a packet open, whereas if that was in a jar, I could just pop it between my knees and unscrew the cap. So I'd considered putting everything in the jar when it was open, but I didn't. But that's just stuff you can adjust as you go, really. Let me just quickly turn my page here. But yeah, movement's going to be your friend, all right? Don't be too afraid of that. And that's the other thing. I have noticed towards the end of this week, my limb getting really cold, like from the elbow all the way down, just feeling cold through that area. So I can't put my finger on what exactly that is, but you know, just the fatigue and the wound repair, all of that kind of catches up with you. And yeah, some of the shock starts to work out, I guess, of our bodies, and that's kind of where we're at, where our body goes a bit cold. But it was really just this arm, like the rest of me felt okay. But yeah, do keep warm, pump the heater if you need to, and anyone that wants to complain about how you look at this stage, or that you've got the heater on too long, just isn't thinking of your welfare. And you don't need to concern yourself with that stuff for now, okay? Don't get worked up about it. This is your time to heal. It's gonna be over, you know, down the line. And yeah, it just takes time, and a lot of patience goes a long way. As easy as that sounds to say, it is to say, yeah, anything you need right now, just take it as it comes and look after your mental health. Bye for now.